with Gracyn Robinson, the founder of Renova Health. We had just been talking about aging in place and how important that is and how that's a big part of the digital health divide. And Gracyn is the founder of Renova Health, a leading digital health company, helping people stay in their homes and doing it in a much more accessible model than anything that's out there today. Gracyn, welcome to the program. Thank you for joining us today.
Thank you so much, Stan. It's a pleasure to be here, and such a privilege after hearing, all the different panelists speak today. So I want to thank you for being here.
No, again,
inviting
just
me
would
to
love.
speak.
Yeah, appreciate that, and would love to just hear a little bit about your background. If you want to talk a little bit about your background and what led you on your journey of founding Renova Health.
Yeah, so my background is in interior design, and I got my degree from Suffolk, my BA from Middlebury, and then an interior design degree many years ago from Suffolk University, the New England School of Art and Design. And so for roughly 2 decades, I worked in multiple different sectors of the interior design industry, more recently in seniors housing and the healthcare space in a blended role between interior design and business development. And then I went back to graduate school to obtain my master's in healthcare leadership from Brown University. And in part of applying to that program, we had to state what it is that we would want to work on as part of our degree. And at that time, I was doing a lot of business development and integration with interior design and senior living. And there was a lot of discussion in terms of the middle market and the forgotten middle and how we were going to meet as a society the needs for aging in place and individuals with multiple comorbidities, having the housing demand and shortage that we see in terms of supply. They're all different care models that are out there, but we're at a time when we're actually seeing, in terms of hospitals closing at a moment when we actually are going to be needing greater access to care, especially for older adults with multiple conditions and Alzheimer's and memory care. So I talk about a leap of faith, and I really appreciated the remarks that Wale provided, but I decided to pursue the creation of a software platform aimed towards aging in place that pairs activities of daily living with desired outcomes and then links them with products and resources for accessible design towards aging in place.
That's fantastic. Yeah, tell us a little bit about the platform. We've got about 5 minutes left, but if you could just give it a minute or so of the platform and what it entails.
Sure. So we are a vertically AI integrated SaaS platform that pairs 3D AR, which is immersive spatial computing of a space. And then when that data is uploaded, so spaces are captured, they're then uploaded into the cloud. And what we do is we perform an analysis with aging in place and accessible design in mind. So we apply hotspots, and those hotspots are able to pair activities of daily living with desired outcomes. And then within those hotspots, we can also include product links that are geared towards accessible design, digital health, wearables, and then an e-commerce. I mean, we're now living in an age of immersive spatial e-commerce as well. So we are, blending and pairing all of these into one clearinghouse to really bring these tools to the public.
That's fantastic. And HITLAB scientists recently did a heuristic analysis of your platform. Tell the audience a little bit about how that helped you in terms of taking the platform to the next level.
Sure. So what we did is we provided access to our minimum viable product, our MVP, and the HITLAB team basically conducted their own analysis using the 3D links that we uploaded within our platform, as well as 2D photos. And then they conducted a rigorous analysis of it in terms of user interface, data flows and capture and analysis, and then provided a really a very comprehensive 28-page report in terms of areas that we could work on improvements, some of which were already, because it's a live construct, the MVP, some of those recommendations have already been solved, but it's a very helpful tool before you go to market in terms of beta trialing your prototype. It's kind of that middle space to be able to get some pre-feedback so that when you actually go to beta and trial, you're already on your way in terms of working through those areas that need work.
That's fantastic. And we've got about a minute left. If you could just tell the audience a little bit about how Renova Health plans to stay at the forefront of innovation in this really exciting area of helping older adults stay at home and age in place.
Sure. Well, I think that, we are at a time that's somewhat plastic and sticky in terms of major growth. And we know that, there's so many, the aging population is not isolated only to the United States. This is a global issue. So we are looking to, help multiple populations and different acuities. If we can be able to bring the means of visualization, immersive spatial computing to the hands of individuals so that they can, link the why they need to do this, given the fact that, every 19 minutes an older adult dies from a fall, with how they can do it, and they can visually see it, be provided with the links to the International Code Council for dimensioning, and then pair it with products. I think we're on our way.
That's wonderful. Well, Gracyn, thank you very much for joining us again today. And please keep up the great work in trying to bring more healthcare equity to the older adult population.
All right. Thank you, Stan. Appreciate it.